Hello and welcome back to the Wellness Pharmacist. I'm Dr. Kat, and today we are reviewing a new study published in the Journal of Clinical Rheumatology on February 3rd, 2025. This study, titled The Lupus Foundation of America Rapid Evaluation of Activity in Lupus, LFA, REAL, Patient-Reported Outcome Predicts Health-Related Quality of Life, Fatigue, and Work Productivity Impairment. Data from the Almenara lupus cohort. It explores how patient-reported symptoms can provide a better picture of lupus disease activity and its impact on daily life. Key findings. Okay, so patient-reported outcomes, PROs, are powerful tools. The study found that the LFA REAL tool, where your clients rate their symptoms and disease activity, strongly correlates with their overall quality of life, how they feel on a day-to-day basis, fatigue levels, and ability to work. So that's pretty key. So if you're listening and you're living with lupus, getting your actual input, taking a questionnaire prior to your doctor's visit, whether it's through your patient portal or you just come to the doctor's appointment and you fill it out right in the doctor's office before you meet the physician, it's powerful. It shows that it improves your quality of life, it improves your fatigue levels, and your ability to work. So this is important. So if you are in a practice that is not currently doing this, maybe ask why. Maybe ask for it. See if they can do that. Number 2 of this study, they found fatigue is a major burden. And this would seem rather obvious if you've dealt with fatigue. I have a personal disclosure here. I have lupus, and fatigue is a major issue in my daily life. Over 70% of people living with lupus in this study reported significant fatigue, which had a direct impact on their work productivity and, of course, their daily activities. It's interesting to me that it's 70%, and it says significant fatigue. I think fatigue in general is pretty significant. I know this number, 70%, to me, that's my opinion, is a little low. I think in any study that you do and in any situation that you're in, especially in a physician's office, lots of people tend to underreport symptoms. You don't want to seem like too much of a burden or, hey, I can handle it, it's fine. So yes, while this is a large number, I do think that it's probably more. I think a lot. I think it's more. I don't know how much more, but I do think it's more because it does have a huge impact on work productivity and our daily lives, our daily activities. So a third thing that the study found was that doctors and patients, I like to call them clients, don't always see eye to eye. This is really not a big surprise. Traditional clinical measures like lab tests and physician assessments often underestimate how much lupus affects a person's daily life. Because when we just look at labs, and I remember being in pharmacy school for this, don't just look at the lab, look at the whole person. And this is really, really important. A lot of the time, we're so busy as physicians, and I get it. A lot of the time, rheumatologists, I know for a fact, they're overbooked. So they're really trying to get through this stuff pretty quickly. They have a lot of people to see. And we tend to rely on those lab tests to tell us the whole story. And we don't take as much time as we'd like, because I think physicians would like more time, to be honest. And we don't take enough time because we have other people to see. We have phone calls, labs to look at, and that sort of thing. So we tend to, over time, rush, unfortunately, for lack of a better word, through the appointments. And then we don't get the whole picture. So lab tests, physician assessments, they do often underestimate how this is affecting a person's life. The study highlights why listening to people, they say patients, I say clients and people, and using these PROs, okay, which are patient-reported outcomes again, PROs, can lead to better, more personalized treatment plans. And I agree. I know that when I've been into multiple rheumatologists' offices. And the initial one, which was a long time ago, a couple decades, She was fantastic. She had a form when you came in, because back then they didn't have patient portals. She had a form, though, that when you came in, she went through fatigue levels. That was one of the main ones, was fatigue and pain. And then she had a picture of a human body, and then you had to circle the joints that were, bothering you. And then it asked certain questions. And I loved that. I thought that, ooh, that's really neat. I get to tell her how I feel. And she really took that into consideration. Now, when I moved, and I wish I could have taken her with me because I really loved her so much. She really listened well. I got another rheumatologist that didn't do this. And it showed. And in my treatment too. And then I got another rheumatologist after that because I went and got, basically a second opinion because I wasn't liking the way my life was going and how I felt. I got a second doctor, and so my third one. And this doctor did a better job than the second one. Again, not as much as the first doctor that I had. So it is important to mesh up really well with our physicians. I don't care what specialty you're in, or even if it's just your primary care physician. If you can, get a second opinion. If you can, get another physician or another specialist if you're not really working out well with that person. And that's okay. It works for both the physician and it works for you too. So what does this mean for you? What does this patient-reported outcomes or pros are powerful tools, fatigue is a major burden, and doctors and patients don't always see eye to eye? I think for a lot of us, we go, okay, yeah, duh. But what does this mean for you? If you're living with lupus right now, your voice matters. I'm a huge advocate for speaking up. How you feel on a day-to-day basis is just as important as what shows up on your lab results. It is just as important. Open your mouth. Tell them, blurt it out. And if you can't, again, I emphasize, bring somebody with you that can. Bring a family member that will speak up for you. Write it down on a piece of paper before you come. Write it down in your phone, on your notes section of your phone, because we have those now. Bring it with you so that you can relay that information and convey that to your physician. Because if they don't know about it, they can't help you, right? So if we're not telling them because, we don't want to be a burden, they can't help us. A lot of time, if we just open our mouths and tell them, they're more than happy to help. They can't help with what they don't know, right? So be your own advocate. Raise your voice. This research supports that. It supports a more patient-centered approach, so a more client-centered approach to care. So don't hesitate to speak up about your symptoms, even if they don't seem to align with your test results, because a lot of time mine didn't align. And I finally found, and I got a functional medicine position at one point too, when I could afford it, and that made a huge difference. But I had to go through 2 functional medicine physicians to really mesh up. So again, I just encourage, if you're able, because sometimes if you live in a rural area, you can't do that, and I completely understand that. If you can, though, do it. Makes the difference. Okay, so short, sweet, to the point. Today, we're going to a caller question. It says, hi, Dr. Kat. My doctor mostly relies on lab tests to track my lupus, but I feel awful even when my blood work looks fine. How can I get my doctor to take my symptoms more seriously? Okay, this is a really great question. That's, you're not alone, first off. Many people living with lupus experience this disconnect. One way to bridge the gap is to track your symptoms. You can track them using a tool like the Lupus Foundation of America. So I'm sure you're probably familiar with them. If you're not, look them up. They have the LFA real assessment, or even if you don't want to use that, then use a symptom journal. Get a journal and write down day to day, hour by hour if you need to, how you're feeling. And you can write it after you eat your meals, how you feel an hour or two later. You can write it before your meals, like when you wake up, your stiffness of your joints, and just all sorts of things. Okay, your moods, that sort of thing. How tired you are, your pain index, where your pain's coming from, what joints, is it symmetrical, is it just on one side, those sorts of things. Okay, and then bring this information to your appointments and advocate for yourself. Advocate for a more comprehensive approach. If your doctor isn't as receptive as you'd like, consider seeking a second opinion, like I've said, from someone who then values patient-reported outcomes. Okay, that's first and foremost. As always, this information is for educational purposes only and does not imply treatment. Always seek the counsel of your own healthcare team because they know you best, right? Again, if you need a second opinion, please get one. You're living it 100% of the time. You matter. So my final thoughts today, short, sweet, to the point, is your experience matters. Research like this shows that patient-reported outcomes should be a key part of lupus management. Keep speaking up, keep tracking your symptoms, and of course, keep working with your healthcare team to get the care that you deserve, because you deserve it. If you have a question about lupus or autoimmune conditions, please send it my way. I'd love to answer it in a future episode potentially. And if you have questions or anything at all, please email me at innovationsmedicationmgmt@gmail.com. And for more insights on autoimmune health and chronic illness, visit my website at innovationsmedicationmanagement.com or follow me on social media. And follow me on social media, please. I'm the Wellness PharmD on Blue Sky. And then I am on YouTube. I have my own YouTube channel, which is the Wellness Pharmacist. So, and I do post these on the YouTube channel as well, these podcasts. And of course, I have the podcast. So you've got a couple of different ways to reach me, a few different ways. And if you have any questions, please send them. I'm here to help or direct you to people that can. And until next time, please take care and be well. We'll talk soon.